Well, according to the World Health Organization, Kenya continues to face a rising burden of diabetes, key factors being obesity, physical inactivity, and unhealthy diet. 1 out of 3 people in Kenya are living with diabetes, and they do not know that they have this condition. And 20% of deaths, this is according to statistics done in 2017, that 20% of deaths are attributed to diabetes. Welcome to yet another episode of Health Nuggets. My name is Aida Munzatsi, and Health Nuggets starts now. On show today, I am joined by Dr. Eric Njenga, who is a diabetologist and endocrinologist, and is going to help us understand diabetes even as we delve further into type 1 diabetes.
Diabetes comes about because there's a problem with regard to the production of insulin in the body. Now, insulin comes from a very important organ in our body called the pancreas, and we have very important cells that are in the pancreas called the beta cells, and we have other types called the alpha cells. So when we have destruction of the beta cells specifically, then now we have a problem with regard to the amount of insulin that is produced. And in certain settings, you can have what is called autoimmune destruction of the beta cells, where you basically have antibodies that are produced abnormally by the body, which instead of doing their correct role of trying to help the body fight infection, then they actually turn against the body's own cells. So it's similar to what is called a civil war. So the army, most times in any particular country, does an important role of protecting the citizens. But you may have a situation where the army may go rogue and start to attack its own citizens. So that's what basically autoimmune conditions mean. And there are several types of autoimmune conditions, diabetes being one of them. But you can have antibodies being formed abnormally, and they could attack, for example, your joints, and you can get rheumatoid arthritis. They could attack your thyroid gland, and you can get hypothyroidism. They could attack your kidneys, and you get conditions like lupus. So when specifically they zero in and attack the beta cells of the pancreas, which are the ones that specifically produce insulin, then that's when now we start to get type 1 diabetes specifically. Why do people get diabetes? So in the setting of type 1, which we'll zero in on, it's very clear. It's not the child's fault. It has nothing to do with that. There's a big misconception that because kids eat a lot of sweets or certain things, that's why they develop type 1 diabetes. It's not the case. It's purely a genetic condition, okay? And you can have these abnormalities, which can lead to these abnormal antibodies being produced, which go and attack the pancreas, and they're no longer able to produce insulin. It could also be triggered by certain viral infections, for example, measles and mumps, which can directly attack the pancreas. And we don't have a very strong family history connection with regard to type 1 diabetes as compared to what we see in type 2 diabetes, okay? So in type 1 diabetes, unless you have a direct relative who developed type 1 diabetes at a very young age, let's say below the age of 14, that may give you a slightly higher risk. But on average, if I have type 1 diabetes, the risk of my children having type 1 diabetes is the same as you who does not have diabetes, okay? So the family history link is not very strong. But for type 2 diabetes specifically, if you just have one member of your family having type 2 diabetes, the risk is a staggering 25%. If you have 2 members, it's 50%. If you have 3 members, it's 75%. So in type 2 diabetes, which we see in the older age group, family history is a very important risk factor that we look at, okay? Type 1 diabetes specifically, the symptoms are very distinct, and even any lay person or parent will quickly pick up that something is wrong with the child when they present with type 1 diabetes. So what are some of these symptoms we're talking about? One, you find the child losing extreme amounts of weight in a very short time frame, okay? So rapid weight loss in a child, which is unexplained. Number 2, you may find that, for example, the child was not wetting his bed, grew up very well, and all of a sudden at the age of 8 or 12, they start to having bedwetting, what is called nocturnal enuresis. So when you start having such symptoms, the child gets very fatigued, the child has visual blurring, they start getting frequent infections, frequent colds, urinary tract infections. Then think very hard that you need to have that child's sugar tested. Because what are the key things? The weight loss is quite dramatic, and you find a child can lose even up to 10 kilos in a span of just 2 weeks. And if not picked up early, the big risk with type 1 diabetes, they can have a situation where their sugars rise significantly, and they can have buildup of acid within the body, a condition that we call diabetic ketoacidosis, which is a life-threatening condition. And those are kids that need to be diagnosed early because they need to be put in a critical care unit to manage that particular condition. So they must go into a HDU, they must go into an ICU, the sugars must be controlled with an insulin pump. They must be given fluids to try and replace the amount that they've lost. And so it's a condition that must be picked up very, very early on. Okay? It's also good to understand exactly why kids lose weight. And the reason is, once they don't have insulin, then the sugars rise significantly. And what happens is that the kidney, most of the time, reabsorbs actually 100% of the glucose that ends up in the urine gets reabsorbed back by the kidneys, if the kidneys are functioning well. But you can have such a high amount of glucose arriving at the kidney that you actually overwhelm the kidney's capacity to reabsorb this amount of glucose. So glucose now ends up spilling into the urine. And what happens is that glucose equals to calories. And calories are what you need to grow, to repair tissue, to develop, as you're going through puberty and other things. So if you're eating calories and most of them are ending up in your urine, your body is starved of a source of energy.
So maybe just on that, the word tissue repairing, maybe you can just connect it to wound healing, or where does that come in?
Okay, yeah. So now when you have diabetes, whether in type 1 or type 2, okay, it affects the immune system, okay? So the immune system plays a very crucial role in the healing of wounds. So when you have very high sugars, it means that you cannot recruit the cells that are required to actually move to the site where the injury is and cause repair, the repair process which is required. So that is affected severely in the setting of very high sugars. So it takes a very long time for wounds to heal. And in addition to that, these wounds can get infected, and these infections can actually end up becoming more widespread, involving other organs. So very common, we get wounds in the feet, what is called diabetic foot, which is a major cause in the setting of poorly controlled diabetes. It starts off a simple wound. You can just be pricked by a nail, or you can be pricked by a thorn prick, and you just get a small wound. That wound doesn't heal. It gets infected. Once it gets infected, it can affect more of the surrounding tissue of the leg, and these toxins which are released from the site of the wound can now get into the bloodstream, and now this can cause a more massive infection that can now lead to an individual now presenting with very low blood pressure, requiring admission to the critical care unit. And it can also end up affecting other organs. So you can end up affecting the kidneys, you can end up affecting the lungs, and it can also even affect the heart. So when infection becomes widespread in the setting of diabetes, it's possible it can actually lead to amputation of the leg, or it could lead to more widespread involvement of the body with several organs failing. Okay? So very crucial that the sugars have to be controlled very well. Any minor injury to anyone with diabetes has to be taken with the utmost seriousness. So if any injury they get, they must get their tetanus vaccination. Then they must have that wound cleaned very well and appropriately seen by a healthcare practitioner, at least a nurse or any doctor, to review the wound. And after that, they should ensure that they give adequate time for that wound to heal. So for example, if the wound is large enough, we may have to consider, for example, offloading the foot so that you don't have pressure being exerted on that particular foot to allow it to heal.
We will get back to that discussion, but first let's have a listen at Donald's story, who is type 1 diabetic, and for more than 10 years he has been living with this condition.
For type 1 diabetic, you have to inject insulin. Your pancreas does not produce insulin at all. Unlike type 2, where the body produces a bit of insulin, with type 1, there is no production of insulin at all. So you have to put the insulin in your body manually. If I can, manually. So you have to inject. So for me, when I was diagnosed, I used to inject thrice, that is in the morning, lunchtime, and in the evening. But as time went and with the management, it changed to morning and evening. So yeah. Yes.
So I'm sure it's changed because of how you managed it, or the work that you did for yourself. What are some of the things that let me say you used to do before the diagnosis and that you can no longer do them now?
The problem, I'd say, when I got diabetes was to be told, don't eat sweets, don't eat carbohydrates, or very minimal amount of it. And when you're young, You see, I was in class 7. So when you tell me not to eat carbohydrates, not to take sugar, it is more like you're curtailing my freedom. And I will go behind the doors, or when I am not at home, I'll go and have it. Truth be said, when you are a kid, you don't really get why you're being told not to take the sugars and stuff. What I'd say about being a type 1 diabetic is it's not about not doing certain stuff or doing certain stuff, but more like minimalizing it. Like if it comes to carbohydrates, it's not about not taking carbohydrates, but taking them in minimal amounts. So what happens is, number one, you have to keep the body, you have to keep working out. That is number one. Because if you, like for me, the thing I do most is workout. I ensure that in a day, I go for 20 kilometers, and if today I don't go, tomorrow I'll do 80 to 100. I ensure in a week, I have to do not less than 100 kilometers of cycling. For people who don't cycle, you run. Sometimes I run 10 kilometers. I ensure I run at least 10 kilometers in a week. So that is running and cycling. For people who don't cycle or who can't run, you can work out in the house or take a walk. All that is very important in ensuring that you take care of your state.
So, of course, when you are diagnosed, you said you are in class 7, you did not understand much of what diabetes is. At what stage did you come to understand, and maybe how did your parents explain that to you?
I came to understand well when I was in campus. That is when I started running, going to the gym. But before that, I had increased, my weight had gone high, and my taking care of my sugars was a bit hard. Because like I said, when you tell me a kid not to take sweet stuff, it doesn't make sense. So I'll curtail, I'll go behind the curtains and eat my sweets.
Did that affect you?
It does. It does, because your sugars will go high. The graph for your sugars will never be. It should be straight or just a bit of highs and lows. But when you're not taking care of yourself, when you're eating sweets and stuff like that, it will, because you're eating sweets and you're not producing insulin unless you inject it. And you see, you have a timetable of injecting it. So if I have injected in the morning and then I eat a sweet, I drink a soda or eat sweets at around 9, see, I have to wait for lunchtime or in the evening for me to inject again. So you see, when I eat it, it worsens the graph.
And now coming to maybe the society, as when you're telling someone that you're diabetic, looking at your age, do people get shocked?
Well, people get shocked, but I will be very sincere with you. I don't tell people. I avoid telling people because of the, what do we call it? The way the society will look at you. So I avoid telling people, and that I think sometimes it's not good, because maybe you're in class. Because like when I was in campus, I have blacked out while doing papers because my sugars went down and I blacked out. So the community, I'd say not a lot of people know stuff about diabetes, especially in Kenya and let's say per se in Africa. Because you see, I have had, there's this time I was at work during the weekend. So I went to work and I worked. So I am, it's not a good thing, but I am a workaholic. So yes, so I worked, and then after work, I left. I went to, nilikuwa naenda kuboard matatu, and then I felt that my sugars were low. I had not eaten my lunch. Felt that I was not okay. So I decided to go to a supermarket, get a soda or juice, and then nipande matatu and eat as I head home, when I get home. So nikaenda kwa supermarket and my hypos got worse. And I didn't know what I wanted. I think I got what I wanted, but nikiwa kwa laini, I couldn't pay via M-Pesa. I was just stuck. You know, when you're having a hypo, you get into a world where you either get to a state where you're in a coma, or you get you start hallucinating. So I was just there. I couldn't pay. So nikatolewa. The soldier came akanitoa, and so I normally walk with this type 1 diabetes, it's written diabetic. So you see, what we are told, even when you go to a hospital, they'll tell you you should have an ID that identifies you, but in Kenya, people really check. Nobody checks. Yes, nobody checks if you are asleep when in levy. So you see, the problem is society doesn't know much about diabetes.
Now, maybe just zeroing on type 1 diabetes specifically, like I said, these complications don't occur very early in the setting of type 1 diabetes. That's why we start to screen for these complications after around 5 years. But the people with type 1 diabetes, because they are picked up early in terms of their diagnosis, after the 5 years, if they're not well controlled, it's not unusual for these conditions to present very early in these individuals. So we have people who have type 1 diabetes who are already on dialysis at the age of 20, for example. Individuals who've had a stroke at the age of 20, 22, 24. There are some we've had people in the clinic who've come with a heart attack and have already undergone bypass before the age of 30. So type 1 diabetes, as it starts off, there's normally a 5-year window where most of these complications don't start to occur. But after 5 years, if the blood sugar control is very poor, you can have a very rapid deterioration of body organs, much faster than even in the setting of type 2 diabetes. And people with type 1 diabetes, if not well cared for, then their lifespan is very short, okay? And again, also, they have to be on insulin because there's no role for tablets in terms of oral hypoglycemic treatment. Insulin is an expensive drug, and access to insulin is a big problem in our country. So if you're not able to access insulin, you can't check your sugars regularly. That's another major problem that we face. People with type 1 diabetes need to check their sugars very frequently, ideally 4 to 6 times a day.
Now, for the 3 types of complications that you've mentioned, there's a story I did of one Donald. So he's been living with diabetes for, I think, 13 years, type 1 diabetes. So do these complications happen to all diabetic patients, or you can maybe have one complication and not focus for Donald, he doesn't have any?
Yes, okay. So the issue of complications is the beauty of diabetes management is if you are very keen with your blood glucose control, meaning that you check your sugars regularly, if you're in frequent consultation with your doctor, if you're following the medication regimens, whether it's insulin or tablets, as per the instructions given by your doctor, you can actually live many years without developing a single complication of both type 1 and type 2 diabetes, okay? So for example, you have people who have had type 2 diabetes for 30 years and still don't have a complication, okay? Similarly, people with type 1 diabetes, if they have this in place, they can avoid all these complications. But like I said, why do you think complications would be very common in our country? And the reason is cost. The major issue that complicates management of type 1 diabetes is access to insulin, access to monitoring, avoiding hypoglycemia, which means low sugars, because the big risk that we see in people with type 1 diabetes, why they have complications developing early on, is that their sugars tend to drop drastically sometimes if they are injecting insulin and not checking their sugars. So the more frequent low sugar episodes they get, those low sugar episodes continuously destroy their eyes, their kidneys, makes the nerve pain worse, and can actually trigger events like stroke and heart attacks if not well controlled. Also, the big variation of sugar in someone with type 1 diabetes. They check their sugar in the morning, let's say it's 21. They inject a dose of insulin, they don't check. Then they find that they're sweaty and they're having symptoms of low blood sugar. They check it's 1.7. That variation of moving from 22 to 1.7 or 2.2. And remember that a low sugar can actually put you into a coma, which may require you to be admitted again to a critical care unit. That big variation is what actually accelerates all these complications. So the key thing to avoid complications in type 1 diabetes is ensure you check your sugars frequently, consult your doctor on the correct dosing of your insulin, have the correct insulin type, okay? Because again, we have different types of insulins, and there are those that we specifically prefer to use in the setting of type 1 diabetes. Ensure you do your checks in terms of your kidney checks at least every 3 months, and you look at a very important parameter called your 3-month sugar average, called HbA1c. That's a test that gives me an average of how good your sugar has been over the last 3 months, okay? As well as following dietary advice, avoiding smoking, alcohol, and other complications, are the hallmarks to try and prevent complications in the setting of type 1 diabetes. So as long as you follow those instructions, then you can actually live for several years with type 1 diabetes.
Okay, so you've talked of that being maybe how to counter a low blood sugar below 4. Maybe you can just to make it clear to our audience, normal blood sugar, and even the importance of me, even without seeing those signs and symptoms, the importance of me checking my blood sugar level.
Yeah, that's a good question. So what's a normal blood glucose level? So if you don't have diabetes, then there are two types of sugars. There's a sugar when you wake up in the morning, which is called the fasting blood glucose. The normal value is between 3.5 to 5.5. Once your sugar is between 5.6 to 6.9, we now move to the next bracket, which is called pre-diabetes. Okay. Then once your sugar in the morning before breakfast crosses 7 or is equal to 7, that's diabetes. So 3.5 to 5.5 is a normal blood sugar in the morning before you take your breakfast. Pre-diabetes is a blood glucose value between 5.6 to 6.9. Once your sugar is equal to or more than 7, then automatically we make a diagnosis of diabetes. Then we have the second type of sugar, which is called the 2-hour after meal sugar. We call it the 2-hour post-meal sugar. So the best time to check a sugar during the day is to eat, then wait for 2 hours and check your blood sugar. Okay, that's called a random blood glucose, but it's more accurately timed if you do it 2 hours after your last meal. If you're completely normal, again, the value should be between 4 to 7.8. Okay, now between 7.9 to 11.0, again, we call it pre-diabetes. Once your glucose level goes above 11.1, equal to 11.1, then that automatically now becomes diabetes. Okay, so those are the normal blood glucose values. Your sugar also should not go below. If you're on treatment, you should not have a sugar going below 3.9. If any blood glucose level of below 3.9 for someone who is diabetic on treatment is classified as hypoglycemia. But normal individuals at times could go down to 3.5. Okay, so we'd say that if you're not diabetic, you should not have a sugar going below 3.5. And there are certain conditions that can actually cause you to have a low blood sugar. So you may have, for example, a tumor in the pancreas with a lot of beta cells, which can produce excess amounts of insulin, called an insulinoma. And that's one of the key conditions that can cause a low blood glucose level. But it's a very rare condition. Starvation itself can also make your blood glucose drop. So you can find someone with a sugar of 2.93. But if they've been starved for a significant amount of time, then the sugar can actually drop. Okay, yeah.
Okay, so we talk of diet and maybe some of the foods that people can take, maybe to normalize their sugar levels.
Good. So first thing is, what are the diets that cause diabetes? Okay, and that's basically any diet that is rich in carbohydrates. Okay, and that's why we have diabetes being more prevalent in certain parts of the country as compared to others. If you look at Central Province and the coast, the diets are largely carbohydrate based, and there are much high incidence of diabetes. As you're aware, Mount Kenya region is called the diabetes belt, and the coast region also is one of the major areas where diabetes is a big problem. And it's typically because of, if you look at foods that are typical to certain communities, I'm from the Kikuyu community, for example, potatoes are a very huge part of our diet. Rice is a very significant part of our diet. Foods like irio, for example, can be very carbohydrate, can have a very high carbohydrate content, because irio means I take potatoes, I take maize, and sometimes even they add bananas to it, and you have a small amount of peas, because peas are very expensive. The ratio of peas to the rest of it will be quite low, and that is a very heavily based carbohydrate diet. Meals like rice and potatoes are common in the Kikuyu community, for example. That's 100% carbohydrate based. The coast, mahamri, biryani are very common meals, and that's an excess amount of carbohydrate you're taking in with a lot of calories that you're taking in. If you look at communities now where if you look at Nyanza, for example, they may have a lower incidence of diabetes because their diet is more protein based. So where you come from has a significant impact. And again, if you look at certain communities globally also, we can have very high diabetes prevalences. For example, in what is called the Southern Pacific Rim, looking at countries like Fiji, Tonga, Samoa, New Zealand, if you look at the Aborigines populations, their prevalences, because of that, one could be theorized because of genetic predispositions, but that could also be a significant component to it. Their prevalences can be as high as 20%. And interestingly, most of the people living on islands tend to have a particular predisposition to developing diabetes. So if you look at the top 5 regions in the world where diabetes is quite prevalent, meaning that you have more than 20% of people in that population having diabetes, their islands. So that's Fiji, Tonga, Samoa, New Zealand, if you look at the people with of Aborigines descent. In Africa, the top 3 countries with the highest prevalence of diabetes is Seychelles, Mauritius, and Madagascar. So there's a particular risk with indigenous island people and developing diabetes. There are specific genes in those individuals which cause them to have diabetes, but again, also their diet could be a major contributing factor. So key thing is that you want to really limit the amount of carbohydrate that you have in your diet. And the rule is, if you want to eat healthy, half your plate should be vegetables, a quarter should be starch, and a quarter should be protein. So those are the key rules, even that we want to advocate for all people living with diabetes. Kids nowadays don't drink water as much because sweetened beverages are easily available, they're cheap. So you find a lot of juices and sodas in the homes, which kids consume large amounts, which definitely will predispose to diabetes. Limiting the amount of sugar you put in the tea is also very important to teach kids from a very early age. Junk food, again, is another big thing that kids and even us growing up, we really loved having the occasional junk food. It is okay to give the kids occasionally, the pizzas and the chips, but now that it's available, we find that kids consume these foods much more frequently. And these are high-calorie diets, and kids put on a lot of weight, and that's the reason why we're having a shift from people developing diabetes at 45, 50, now to 25 to 30 years of age. And it's purely because of our diets. Number 2, we're not active anymore. So kids also need to have that minimum duration of time in a day. At least for young kids, 1 to 2 hours must be spent in some form of physical activity. For adults, we say at least spend 30 minutes of your day doing something active, where you're going to raise your pulse rate above 100 and where you'll break a sweat. So very, very key to also add that. Smoking and alcohol are other key things which drive diabetes very early on. Alcohol, as you're aware, is a toxic to the pancreas and it can cause what is called pancreatitis. So again, a very, very common cause we are seeing in the hospitals nowadays is younger people coming in with pancreatitis because of excessive alcohol intake. So these are all key things that can actually drive the rising burden of diabetes in our country.
Okay. So in terms of diet, you'll say it's just managing what you're taking.
Managing what you take. Yeah. The other common mistake people with diabetes also should try and avoid, which is a very common cause of blood glucose rising, is it's a very common tradition for us to take fruits with all our meals. You take your breakfast, you take a fruit. You have your lunch, you take a fruit. Remember the starch that is on your plate. Then if you add a fruit on top, fruit at the end of the day is still sugar. Okay? And people tend to consume large amounts of fruits, thinking that it's good to eat fruits, but if you eat them in excess amounts, in people especially with diabetes, they do raise sugar significantly. Because at the end of the day, the fruit is broken down into simple sugars like sucrose and fructose, and those are going to spike your blood glucose levels. Certain fruits are most notorious. The number one fruit which can really raise your blood glucose is a very popular fruit in the country. So watermelon is a very popular fruit, but it's a fruit which has the highest glycemic index. So that can easily spike your blood glucose levels. So we say try and limit watermelon use if you've been newly diagnosed or if you're having problems controlling your sugars. But if you have to consume a watermelon, just have not more than 2 small slices of watermelon. That's the maximum you can take. The other common practice is individuals juicing fruits. So if you put in bananas, apples, mangoes, watermelon, and juice that and drink that, you are consuming a huge amount of calories at one go. Okay? So what we advise is take the fruit in single pieces if you have diabetes. And also generally, if you're trying to cut down your weight, that's a good way to actually start. Because juicing is another huge craze that is going around. But people inadvertently consume a huge amount of calories with these juicing fads that are going around. Number 2, pudding, where you again cut up all these fruits and put them into a bowl. You're also consuming a huge amount of calories in one sitting. So always advise people who have diabetes to eat their fruits in a single piece. Let them take an apple as a single fruit, an orange as a single fruit. Again, they can eat any fruit with the exception of being careful with watermelons and pineapples. But even those, if they're going to eat, as long as you take a small slice, that's okay. But all the other fruits, whatever is available, whether you're at the coast, whether you're at Nyanza, whether you're at Meru, eat as a single piece. If it's a banana which is very large, then you have to cut it in half. Mangoes that are very large from Kilifi, Kwale, again, take a quarter of it. Okay. Parting shot is that hypertension and diabetes are silent killers. So I advocate, always have your blood glucose checked at least every 6 months. have frequent blood pressure checks, ensure that your weight is within control. And in fact, a very important parameter for people to check is what is called their waist circumference, okay? And that is a very sensitive marker of what's your risk of developing diabetes or cardiovascular conditions. So what we say is for men, at least try and keep the waist circumference below 88 centimeters, okay? And for the women, below 80 centimeters, okay? So those are very crucial things that are simple, and you can try and, so simple to do, simple to check, but have a very huge impact in terms of determining your future risk of developing hypertension and diabetes. Again, if you have a family history of hypertension or diabetes, just know that you have a very high probability of developing these conditions in the future. So again, just being conscious to live a healthy lifestyle. If you are a lady who's developed diabetes in pregnancy, your risk of type 2 diabetes is as high as 30 to 50%. So again, lifelong follow-up and living a healthy lifestyle is very, very key.
Okay. Thank you so much, Dr. Asante sana. Okay. Well, it's all about management and checking your blood sugar levels frequently. And being diagnosed with diabetes is not a death sentence. If well managed, one can actually enjoy and live a full normal life. That is all we had for you from Health Nuggets. For any questions and comments, you can always reach us on our social media handles. And special thanks to Dr. Eric Njenga and Donald Mwangi. My name is Aida Munzati. Until next time, your health matters.